What is up, guys? Justin Brock here. All right, I'm trying this again. Was having a little connectivity issues. Just want to see if you guys can see me. So if you can see me, please head over to the comments on the video and tell me where you are watching from. We're going to break down the Humana PPP, the commission variable differences, some of what they're doing. Been talking to them. We'll head back to the UHC thing. We'll talk about what's happening in the comp world, what's good, what's bad, what the pros and cons are depending on who you are and where you are watching from. Okay, loud and clear, JB. All right, here, I'll just go ahead and get started then. So today I'm going to talk about the plan exodus, Termageddon, as some people are calling it. We're going to pull up some different notes. I'm just going to go through the Medicare agent purge, the CMS crackdown that hits carriers, star ratings and why those play a factor right now, plan flipper call centers taking consumer-initiated retargeted calls, plan mirroring that's going on with Humana, less than fair market value street comp in some cases with Humana light plans on select plans, light plan changes on select plans, UHC on certain commissionable PPOs, whether it's new or plan to plan, and reduced overrides, UHC on UHC standard PPOs, non-commissionable, and some of the reasons that certain geographic areas are being targeted for non-commission in certain areas, UCare, Sonder, Blues, Regents, pullouts, like that kind of stuff. Then we're going to talk about what we can do about it, how long we expect the trajectory to be like this. And yeah, so that'll be mostly what we're talking about. I'll be looking at a couple of different resources. One will be the PPP that just came out from Humana. Pull that up here. Okay, and so, and then one part of this, I'll be just paraphrasing from the snippet that we got from Humana about this morning. So, so here it is. Attached is our PPP, which lists our non-commissionable plans for 2026. This also includes our commission schedule for agents for 2026. FYI, P2P will pay partial comp to agents. All new to Humana will pay full comp. Additionally, we have created a new set of plans for new customers designed to bring high-quality, person-centered care to more communities. Specifically, we will offer new HMO and PPO plans whose benefits are comparable to those on our existing HMO and PPO plans. We think these plans will be attractive to new customers and help agents grow their book of business. New HMO details. The new HMO plans will be offered on both our H4461 and H1036 contracts. The benefits on the new plans are comparable to the benefits of on the HMO plans on contracts H0028, H4623, H5619, and H6622. The new PPO details. The new PPO plans will be offered on H7617 contracts. The benefits on this new plan are comparable to those benefits on PPO plans on contract H5216, which many of you are familiar with. The very large block of H5216 is nationwide. The commission approach is new HMO, new PPO, commission status, new to Humana members paid full, plan to plan, reduced commissions. Legacy HMO and PPO, so the old plans that existed before, commission status is renewals are paid. So anybody that's on those plans, they're not going away, they're just not commissionable, and they will be paid. The renewals will be paid at the new 2026 fair market value. If you take those people and you move them to one of the new plans, you are going to get a reduced commission. And I'll go over what that reduced commission looks like in just a second. But the new to Humana, but if they're new to Humana and you put them on one of those old plans, you are not going to get paid. So, and there's not really any way to flip them without flipping them to either a non-paid plan or a reduced comp plan. So Humana is introducing these new HMO and PPO plans they want to target to leverage for new customers. We will pay commissions for new to Humana members placed on the HMO and PPO plans. Existing members can continue to get their health plan needs on the existing legacy plans. We will not pay commissions on new to Humana members placed on legacy plans. And then they have a list of the mirrored plans that is available. And I'll see about who we're getting that to. Anybody that's in our downline that when someone becomes an agency partner of ours, is a valued partner, they enter a thing called the BBI, Inner Circle, and we try to get a lot of these resources out to them as fast as possible. But this one is just getting so much traction in the Facebook group and stuff. I wanted to come on here and talk about it. So on the light plan change comp. So if you take someone from an old H5216 plan and you move them to the new H7617 plan, the comp for it is going to be $165 instead of $347, and then it will be prorated just like $347 would, depending on the effective date. So for a January 1st effective date, it's $165. Now, there's really no good reason to do this because the plans are extremely similar, if not identical. Now, there may be some small nuance, so don't tell me like, hey, in Boynton County, Massachusetts, there's this. Like, I don't care about that. Like, broadly, what I'm talking about is very, very rare that this would be a necessity. And from what we've been hearing is if an agent's doing this and moving them, they're going to be kind of a one-strike rule. Like, you're not going to get a lot of options. If you're out moving people from these legacy plans to the new plan, it's an issue. Now, why is it an issue? It actually stems from Humana's conversations with CMS. CMS approved these new plans with higher star ratings, which does help Humana's reimbursement rating for or pay rating on what they get when a member signs up. But part of that conversation was, hey, we're not going out and rolling all of our existing people on a 3.5-star plan to a now 4.5-star plan. We're going to maintain those people there, and we're going to take protocol measures to make sure that we're not flipping this. So actually, if you think that this is something CMS should get involved to help, it's actually driven by the conversation with CMS because they don't want people flipping these membership around just for the hell of it. So just remember, CMS's number one goal is not to make sure agents are compensated fairly. CMS's number one goal is to protect the consumer. And in this case, fair compensation, at the full street or fair market value would actually conflict with what's best for agents or for consumers. So that is a big change. That is something that's big in there. There is good news here. So, one, if you're doing high quality business and you're bringing new membership to Humana, they have an onslaught of new plans that are quality plans that are going to be very well positioned in the market and in a lot of markets, tons of markets. And they're going to be fully commissionable at the new fair market value for 2026. And that is the business that they want to get. So, going on to talk about one other thing. PDP commissions does look like they're remaining the same. I don't see any changes on there. I didn't really pay much attention to that beforehand, so somebody can correct me if I'm wrong. But the way I understand it is Humana will continue to pay PDP commissions at kind of a very standardized rate. So, okay, so that is a big change on Humana. Love any questions we have about that. And in the meantime, I'm going to move on to, let me pull my notes up here. So, okay, I'm going to move up here to United Healthcare. So, and then we'll go back here for the star ratings have a huge impact on how much a carrier is paid per member. So just remember that. So if they can have plan members on a 4.5-star rating, they can afford more plan membership than they can otherwise. I know a lot of agents think, why can't they afford more membership? And you have to understand that it kind of sucks because some of the agents that understand this the least and are bitching the loudest, if they stick around, a lot of them will benefit the most because this is going to disproportionately negatively affect the plan flipping call centers over you guys that have local agencies or brick and mortar or field, and that's a good thing for the industry. So there is some level of correction that's happening here. We don't need this ever bull run in Medicare Advantage has created some, nefarious activity. So, so here we go. Plan flipper call centers are taking consumer initiated calls, or been taking a lot of retargeted calls. So lead vendors that plug into these call groups that just don't know how to market themselves and then just buy calls will buy the calls, and then they create a custom audience of the people that are calling in, and then they retarget them to get more and more calls and drive their calls down and keep selling them at the same rate to multiple people, which has created a lot of turnover. In doing that, it's brought down a rate called accretion to all-time lows. And so Humana made the decision the other day that if an agent had a ratio of 5 to 1,000 CTMs, whether they're founded or not. So 5 to 1,000, let's say somebody had 100 enrollments, they could have 1 CTM and be in that range. So 100 enrollments with 1 CTM puts you at the 5 per 1,000 ratio. So if I have an agent that has that, and their accretion, meaning the amount of the plans they write with Humana that go into effect, that actually take effect, is below 69% or 68% and below, that they're automatically terminating those agents. And so there were a lot of people that did get terminated. A lot of those agents would have been in high bandwidth telesales activity centers, but these are agents that for years would have been completely tolerated, and this is a year where they were not tolerated. So there is a little bit of an agent purge on that side. Now, some of you will cheer for that, others will shake in your space boots. It depends on how you're navigating the business right now. So going back to this less than fair market value street comp. So obviously Humana is doing this on the like plans to discourage people from switching people from a plan that is identical to another plan. I don't think you'd see as much of that in like community, local agencies, brick and mortars. But it could be annoying if you have a customer that comes to you, they don't even know who their agent is, but they're on a Humana 5216 plan, and you want to move them to an H7617 so that they become your customer. But there's really no benefit, to doing that for them other than they become your customer. So it's going to be heavily reduced comp, and if you're doing a lot of that, you are going to probably get flagged as someone enrolling people in a plan that doesn't benefit them. So here we go. UHC on certain, also on the less than fair market value, UHC is doing this to discourage enrollment in a lot of areas in their standard PPOs, or say, hey, if you do enroll in this, we want to pay less for it because our profit margin is less. So you're basically participating in their profit margin or their actuarial information as well by reducing your comp, by having your comp reduced. But they have the product, you don't own the product, so you don't get to decide what you get paid for. Fair market value comp a lot of times is quoted by agents like, I can't believe they're paying us below fair market value. I looked at CMS putting out fair market value as that is the cap that they can pay for the acquisition or for the sale of a Medicare Advantage plan. So it's fair market value is not, this is what you should be paid. It's really, in the case of CMS putting out, the most that you can be paid. Now, UHC is taking a different approach too. They're not taking renewals on any plans that remain in market. They do have a lot of SARs that are happening, which we'll talk about some service area reduction in a second, but they have plans that are remaining in the market that are now non-commissionable that will pay renewals on. Those plans renewals will not adjust to 2026 fair market value, I'm pretty sure. So those are going to stay at the lower rate, but for new sales, and that's the PPOs that are going non-commissionable. Typically for HMOs and special needs plans, those renewals will adjust to 2026 fair market value, and of course new sales January 1st and all will be fair market value. And they do not have any plan to plan specific, like intercarrier lower comp. Now, when I say plan to plan or like plan changes, when Humana pays less for a like plan change, it's from Humana to Humana. This is not a like plan change from UHC to Humana that they're paying less on. It's churning Humana customers into other Humana plans. So, okay. Now, Humana also is going to be non-commissionable on all of the enrollments in their legacy plans. So for anybody on Sunfire and Connecture, those plans should show as either non-commissionable or not show up at all. However, we keep getting asked about reduced comp plans showing up in Sunfire. Right now, they have indicated they're not going to remove reduced comp plans or even indicate in any way, but I know that there's increased push for them to at least have something that says reduced comp beside the plan. Okay, reduced overrides. United Healthcare actually reduced overrides as well. They started this back in the summer on new standard PPO enrollment on a lot of standard PPOs. They didn't, not all standard PPOs, but a lot of them, or may have been all. Anyway, they reduced override, and they reduced it sectionally at each level. So it was something like $14 at each level until you got to like MGA, and it was like 50 or something like that. But anyway, there would be a reduction there. So the non-commissionable plan push. Now the geographic targeting. So certain non-commissionable pushes were based on plan types that they did not want to grow right now. They wanted to kind of flatline and more or less shuffle their membership around to where it's more profitable and kind of get their sea legs back. This is what United Healthcare wanted to do with Humana. They wanted to grow, but they wanted to grow in plans that they have adequate star ratings in, and grow at a rate that they feel like they can afford. And on the non-commissionable pushes geographically that have happened with all carriers, but namely United Healthcare, a lot of that is tied to things like UCare in Minnesota, dropping 26% of Minnesota's Medicare Advantage members are in UCare, which is not a United Healthcare company. It's a medical facility owned plan that is dropping. And so United Healthcare in this year had a bunch of PPOs up there, and they said, we do not want to absorb that business, so we have to not pay people to enroll into that business. Same thing in Idaho with Blue Cross of Idaho and Regents. Seen some other stuff in like Connecticut, Maryland, just different areas where we're seeing that. Then past that, you'll see some spotty action, maybe in Florida with certain types of plans, etc. So UCare, Sonder was another one mid-year this year. The Blues, Regents, there's a bunch of them. There is actually a huge chart that I have pulled up in front of me that is the announced expected 2026 plan terminations. And it's 285 pages long. And this is broken down by different towns across America, and how many are leaving. So it'll take like Arizona, for instance, and it'll say, well, let me just give you a better state. It'll take, let's say, Minnesota, and it'll say, okay, there's going to be 152,000 188,251 plan terminations in Minnesota. And so, no, that's total enrolled 188,251, or that's plan terminations. Yeah. And so most of those are UCare, 174,000 UCare members. And then it breaks down which plan they're on and in which areas. And then it goes all the way down into, let me see if I can get to the right parts. It gets down to the other plans that are also existing in that area that are ending, but predominantly UCare. So it's just a broken down chart. So we have those charts now available. Our distribution, we've already sent them to. So let me go back to my notes here and make sure I don't get off track. So what's going on? What's going on is the tranches of regulation that have happened over the years have matured in to kind of flatline and be very mature in 2026. At the same time, there has been increased, scrutiny on prior authorization and different cost controls of Medicare Advantage. There have been an increase in field-based call centers entering the space, doing plan swaps that make it difficult for profitability to take effect, and there's been overwhelming actuarial and medical claims losses are up, and then the actuarial data just keeps emerging faster and faster, and so the companies are trying to figure out how to get profitable. And it's just a shakeup. It's a settling. It's a foundation settling, and so we're just as agents have to navigate this. But what can we do to navigate it? Well, like what we work with all of our downlines on is selling ancillary, knowing which ancillary policies to sell, how to sell them, doing that. Leveraging the $0 PDPs that exist in the market to sell more ancillary or med subs. That's something that a lot of people aren't doing. Get well versed in med subs. So all these MA only people, you need to be able to land more med subs. It's way more predominant than you think. It's not just rich people that buy med subs. Don't panic on MA. Get wider geographically. So, when if you're doing seminars, go further out and get into some areas where you're not so isolated to any sort of plan exodus that might be happening. And don't have this fear that the carriers are doing away with us. The only way the carriers are doing away with us right now is if they don't want to be in the market at all. Like if they just want to flatline and start to decline. But they can't just continue to grow all the time forever. It's just not always a bull market. So yeah, that's a lot of what we're talking about. I'd love to answer any questions that you guys might have about things that are happening. And if you don't have questions soon, I'm probably going to end this and share it over to the group because I think I ran this live on my personal page. But if you don't have any specific questions, of course, we have a room with 25 to 30 agents in here right now that are at Agent Bootcamp learning how to make their business better. We have behind the agencies. We continue to have behind the agencies. We'll have more coming up in January, February, March, etc. We just announced the winners to our Pebble Beach trip, which is our internal agents list. And in the first quarter, we're actively going to be looking at bringing on more agents that want to be part of a company that's actually in the trenches looking at how to build with you guys and providing good information. So are we seeing these trends with any other carriers? Yes, to some degree, but Humana and UHC are such pace setters in the market. The compliance trend with Humana right now, they're taking a pretty hard approach to it. Definitely seeing some strong compliance trends and have for a while with HealthSpring, WellCare to some degree from a monitoring standpoint, maybe a little bit of termination on the individual agent basis level, and then Devoted. Devoted, can be pretty strict on that front. Haven't seen any crazy actions on the compliance front with Aetna or United Healthcare right now, but we expect to sorry about the yawn. We expect to see some. It's just that this is the way the market is now. We think United Healthcare is controlling their enrollment more with compensation strategy and plan availability, whereas Humana may be trying to weed out some bad agents in the name of compliance and having good relationships with CMS. But at the same time, they're also probably trying to control the volume of enrollment they get. And the best thing they can do is get rid of the lowest quality enrollments they're getting. From there, that is, the primary things I wanted to talk about today. So I appreciate you guys taking the time to be on here. If you have any questions, put them in the comments. We'll try to answer them after this is posted. It's live right now, but after it's just posted static. And we'll be here. Keep on trucking along. AEP is going to be great. Don't let all the whininess get in your way. It's going to be a good one. There's going to be a lot of confusion. There's less marketing money in the atmosphere this year, which actually is good for the little guy in a lot of ways. Now, some people say a lot of marketing money spins up a lot of interest, and that is true too. So it's a catch-22. But at least for this year, I think it's the year for you to go and be loud and make your money. If your entire lead strategy is buying inbound calls from third-party vendors, and you're in my distribution, I want to talk to you because that's probably not a great solution for you. It's going to create more problems for you, for us, etc. If you need to figure out now, your sales volume will go down, but your quality will go up and you'll make more money and you'll be here for the long haul if you focus on doing the right thing and doing marketing that doesn't, bring in the chronic complainers. So, thank you guys.